Hey, my name is Bo Ramos,
This is Michael Edwards.
And Wyatt Bronner.
and together we made a slideshow on the topic of communicating with non-English speaking patients. So before we get going, a little bit of quick info. If you haven't had to try to deal with a non-English speaking patient yet, chances are you will have to soon. About 20% of the population in the United States, or about 57 million people, speak a language rather than English in the home. There are about 320 other languages spoken in the United States, and in Oregon and Washington, they're in the top five, with Washington having 163 languages spoken and Oregon having 138. Non-English speaking patients also have the highest readmission rates into hospitals because of the difficulty with them understanding how to manage their conditions or when to take their medications. Today we'll be talking about three different topics. First, we'll be talking about how it is hard to do and what are some challenges that you might encounter when speaking with non-English speaking patients. The next are some tips and you to try and make it easier for both you and the patient in communicating through that language barrier. And then lastly, we will be talking about some tools that are pretty common around the emergency service world today and that are pretty easy to access. So first off, the challenges. First of the challenges is the big one, the language barrier. This one is the challenge itself entirely. It's very difficult to talk to somebody and gather the info you need when you can't effectively speak to them. And when you can't effectively speak to them, it makes it very difficult to find out the underlying problem. Another challenge is cultural differences. When speaking with somebody from a different culture, one of the big things you don't want to do is disrespect them or their culture. For example, different things mean different things among different cultures. And for example, in Japan and the United Kingdom, people tend to try not to show an outward amount of emotion, while in the United States, people accept a lot more outward showing of emotion. Next, we'll be talking about some helpful tips.
So, the first thing we're going to talk about is avoiding slang. So, something that we may understand here as slang, or one person might understand, may not be understood by another person that doesn't speak English at all. Every culture has their own slang terms, and it can be difficult for people who do not speak that language to understand what they're talking about. For example, there are a lot of slang words used by native and fluent Spanish speakers, and while some people may not know what those slang words mean, people who do speak Spanish or only have a basic knowledge of the language would not know what they are saying. By keeping it simple and making it easy, we're both able to understand what everybody is talking about. So next, we're going to be talking about being culturally sensitive. Cultural sensitivity is described as being aware that a cultural difference and similarities between people exists, and that happens without assigning them value, positive or negative, better or worse, right or wrong. This means that you are aware that people are not all the same and that you recognize that your culture is no better than another culture. We never want to talk down to a patient or make them feel any less, if that's on purpose or by accident. This can be taught to people and their organizations, such as fire departments, for example. It's really important to remember this so we don't offend a person or a patient on a call or anger them in any way. Next, we're going to talk about body language. So body language is referred to as one of the universal languages, or nonverbal. No matter where you're going to go in the world, body language most of the time is going to be understood by just about anybody. It's important to keep in mind, though, that if some things that we may see normal or another culture may see normal may seem or be viewed as an insult by another or not allowed. A handshake, for example, might seem normal to us, but if we were to go up and start to shake hands with another person who their culture they didn't see that as normal, or they even took that as an insult, that could be very bad on a call for us. And so hand motions and facial expressions can be used to attempt that nonverbal communication. And one of the ways to fix these problems or kind of prevent them is to learn some basic greetings. So a really easy way that we can get a foot in the door and start talking to our patients is take a little time and learn some basic greetings for patients. For us here, we're in Canby. We have a very large Spanish-speaking community, so we actually have programs and classes here at the department that we can take to learn some basic greetings, some basic questions to figure out what's going on with the patient, what their chief complaint is, allergies to medications, what hospital they want to go to, and things of that nature to at least get us a good start into patient care until we can get to either an interpreter or a crew member that is fluent in that language. Next, we're going to go into keeping it simple. So something very important that people often forget to do when speaking with non-English speakers is to keep it simple. We want to use words that can be similar in multiple languages or have a similar meaning. We don't want to use complex words or sentences that could potentially confuse the patient. Also, something important to do is to stay away from verbal expressions. An expression that may mean one thing to you could mean something completely different to people of a different culture or language. If you use very basic words, there is a potential that they could somewhat understand you and what you're trying to say. So we want to try to use that when we can. Another way to keep it very simple is to ask questions that have yes or no answers. If you ask these types of questions, they have simple one-word yes or no answers, and those words are very common between languages.
Next, we'll be talking about another topic of tools. Tools that you can use in the field and also in other settings such as the hospitals.
So the first tool that we're going to talk about is interpreters. Interpreters are one of the best tools that you can use when speaking with people who don't speak English. There are two types of interpreters, in person and over the phone. The most ideal of the two is the in-person interpreter because they can be on scene and directly talking to the patient. In-person interpreters are becoming easier to come by due to the increase of non-English speakers. While an in-person interpreter is the most ideal of the two options, it won't always be readily available. If there isn't an interpreter on scene and you urgently need to ask a question, there won't be enough time to wait for somebody to show up. In this case, you can use an over-the-phone interpreter. Over-the-phone interpretation companies provide skilled professionals specialized in interpreting over the phone and in-document translation. They are capable of interpreting over 100 languages. While it is less ideal because the person isn't physically there, it will still get the job done. The benefit of an over-the-phone interpreter is the immediate access you can achieve as long as somebody has their phone on them. Along with immediate access, you don't have to worry about somebody not picking up the phone. The over-the-phone translation companies provide 24 around-the-clock services. While this service works great, there is also more drawbacks that stem from the translator not physically being there. Depending on the environment, it could potentially be hard to hear the translator. For example, if the translator is asking a question for you, but the patient is unable to speak very loud due to sickness or some other issue they may have, then the translator won't be able to effectively get the information he or she needs. Overall, though, interpreters are one of the most effective methods when communicating with a non-English speaker because they are capable of speaking both languages that are present. Another option you may have is to speak with family members on scene. Many times the kids in the house will speak both their native language and English since they grew up in the U.S.
So let's go back really quick. Like Wyatt was saying earlier, Canby, for example, has a very large Spanish-speaking population. And within Canby Fire, they've really embraced this interpreter thing. And one of their full-time firefighter paramedics, Julio Quevedo, he is fluent in both English and Spanish. He grew up in Mexico and he moved over to the United States when he was about 13 years old. So he speaks Spanish Spanish very well, and he speaks English very well as well. So he is a huge asset to have on your crew, because a lot of the times you do run into those Spanish speaking only families where sometimes they might have a younger child who speaks English and they can be your interpreter, but oftentimes they might be a little shy, or nobody in the household speaks English. So having Julio on your crew, or another crew member who is a fluent Spanish speaker, is very useful, and he's a big asset to have on the team.
Another tool that is very helpful is apps. Apps are a great way of communicating with patients. There are thousands of different apps out there that provide many different services. I found a specific app called Language Line that is very helpful because it connects you directly with an interpreter. You simply select the language you want, and then you will be patched in with somebody to help you. The only potential problem with this app is if you are unable to identify the language that the person is speaking. However, that is rarely the case. Another great option for translation is Siri. You could be in a situation where you don't need a translator because you are asking a few simple questions. You can tell Siri a question, and it can translate it for you, allowing you to ask the question in the patient's language. This also works the other way around. If the patient is speaking, Siri is capable of translating it back to English so you can understand his statement or question. Like over-the-phone translators, apps are very convenient. Nowadays, most people have some type of smartphone which allows them access to the translation apps. As long as somebody on scene has their phone handy, then you will be able to use the apps whenever you need. They are also very easy to use, especially Siri. You just open up Siri and start speaking, and it does all the translating for you. On top of all of this, the apps are free. Yes, there are some apps that you could purchase, but they provide unnecessary features that you don't need. There will always be some free translator app, and if you can't find one, there's always Google Translate.
And one of the cool things about Google Translate is it again does the same thing that Siri does. You can speak into it, and it'll register the language that you are speaking, and then it will pop out what your selected language you would like it to be. And Google Translate has a bunch of different languages in there, some of which I've never even heard of. So Google Translate is probably the best free app that you could get in the App Store for this.
So another great tool that is technically an app but can be used to communicate with an interpreter is FaceTime. FaceTime allows you to have face-to-face contact with the person who is interpreting for you without them actually being present. All you need to use this is to have the interpreter's phone number to call them. A great time to use this would be if you are struggling to communicate over the phone between three parties. FaceTime allows each party to see everyone while they are talking, which can hopefully eliminate the confusion and any other issues that you may be encountering. And another tool that we're going to talk about is writing. Writing is a great tool at your disposal when communicating with non-English speakers. If the person speaks a little bit of English, then you may be able to use some words when writing, but more often than not, writing will involve pictures of some kind. Regardless of what language they speak, if you're a decent artist, then you should be able to get your questions across. An example would be if you draw a medicine bottle, then they would hopefully be able to understand that you're asking what kind of medications that they take.
Okay, and then the last tool we were going to talk about today were expression cards. These expression cards, they're popping up more and more everywhere and all around us these days. The two groups that are most common for expression cards to be made for are the Spanish-speaking population and pediatrics. Sometimes neither of them are able to speak English or describe what exactly is wrong with them, whether that being they don't know how to describe, they're too young, or maybe they're a little too shy to do it. But if you have these cards with you, you can pull them out, and they have little pictures like on the screen, these emojis that kind of represent what's wrong with them, how they're feeling, what parts of their body may hurt, and there's also it in the written form as well. And right here is a real life example of this. These are Meridian Park Hospital in Tualatin's expression cards. They have both an English and a Spanish version, and as you can see on here, they have pictures and different descriptions of different symptoms people may or may not be feeling this day. And another one are, for example, in Canby Fire, they have in their ambulances both these same type of expression cards for adults, and they also have pediatric only expression cards where it's more simpler. It's just more geared towards the pediatric population. So overall, as you can see, like everything in life, it has its challenges, and this is very difficult to do for both parties when they don't speak the same language. But there are very many tips and tools out there that you can use and make that, and those tips and tools make everything exponentially easier to do and communicate with everybody on scene. And like anything else in life, it can be done with just the right tools, the time, and the knowledge of how to do that. And we would just like to thank everybody for listening to our presentation today. We really enjoyed making this presentation, and I think that we've all learned a lot about this topic. Like, for example, not using slang. That's something that's so simple that a lot of people could forget not to use, because everybody uses slang every single day of their life, whether they know it or not. And if you just remember to cut something as simple as slang out, that can make a world of difference trying to communicate with non-English speaking populations. So again, thank you, and hope you guys enjoyed our presentation. And right here is our works cited page. Thank you again.